Picture this, you're lying on a hospital bed, about to have surgery. The anesthesiologist says, okay, you're gonna feel sleepy now. And suddenly, bam, you wake up hours later, totally confused, the surgery done. You're probably wondering, wait, what just happened? Did someone pause my brain? Well, kinda. That's anesthesia, and today we're going to uncover exactly how anesthesia works, because despite being used millions of times a year, the science is actually kinda wild. Let's start here. Anesthesia isn't just sleeping, it's way more complicated. In fact, it's a very controlled state involving 4 key things. Unconsciousness, meaning you're totally knocked out. Analgesia, which means no pain. Muscle relaxation, where you don't move. And memory loss. And doctors achieve these effects using a carefully balanced cocktail of drugs. You've probably heard of anesthetics like nitrous oxide, the laughing gas, sevoflurane, an inhaled gas, or propofol, the white milky stuff Michael Jackson famously misused. And doctors can deliver these drugs either by inhalation or through an IV in your arm. So these anesthetic drugs race into your bloodstream and head straight for your brain. But once they're there, what exactly do they do? Your brain has billions of neurons constantly chatting with each other through electrical and chemical signals. Normally, these neurons help you keep you awake and aware, but anesthetics disrupt this communication. They do this by mainly affecting neurotransmitters, the chemicals your brain uses to send signals. Specifically, anesthetics boost activity of a neurotransmitter called GABA, which is like your brain's calming signal. At the same time, they block excitatory neurotransmitters like glutamate that usually keep your brain awake and alert. Think of your brain as a crowded house party. Neurons are the guests, excitedly chatting away, passing signals back and forth. Anesthesia is like the neighbor who calls the cops. It slows down the party, quiets the noise, and eventually everyone just stops talking altogether. Your brain activity slows dramatically, and consciousness fades. This state of reduced brain activity makes you feel completely unaware of what's happening around you. It's not sleep, it's something even deeper and stranger. Your brain literally stops processing the outside world. Now, let's talk pain, because surgery would be pretty awful without anesthesia, right? Pain signals normally travel from your nerves, through your spinal cord, to your brain, which interprets these signals as ouch. But anesthetics block these signals at several points along this pathway. They prevent nerves from sending strong pain signals to begin with, and they also stop your brain from decoding any signals that sneak through. So, even though a surgeon might literally be cutting into your body, sorry to be graphic, your brain has zero clue. It's just chillin', completely oblivious to what's going on. But wait, if you were briefly aware of something during surgery, you'd remember it, right? Actually, probably not. Anesthetics usually cause temporary memory loss by messing with a part of your brain called the hippocampus. This means even if you're slightly aware during surgery, which is incredibly rare, don't worry, you wouldn't remember it. Your brain basically hits a pause on memory formation. That's why anesthesia often feels like time travel. 1 minute you're counting backward from 10. The next, you're suddenly in the recovery room asking, wait, are we done already? But if anesthesia is powerful enough to knock you out, how do you safely wake up afterward? Well, that's the anesthesiologist's job. These highly trained medical experts carefully monitor your blood pressure, heart rate, breathing, and brain activity throughout the surgery. When it's time to wake you up, they slowly reduce the anesthetic drugs. Your body naturally breaks down and removes these drugs from your bloodstream. Your neurons start firing again, and your consciousness returns. You open your eyes, groggy and confused, wondering if the surgery even started yet. But isn't anesthesia kind of risky? Well, yes and no. Modern anesthesia is extremely safe. Serious complications are very rare, but it's still a delicate balancing act. Too little anesthesia, and you might wake up during surgery. Yikes. Too much, and vital functions like breathing or heart rate could become compromised. This is exactly why anesthesiologists spend years training. They expertly manage these complex medications to keep you safely unconscious, but totally stable. So there you have it. Anesthesia isn't just sleeping through surgery. It's a carefully choreographed chemical dance, slowing your brain activity, blocking pain signals, temporarily shutting down memory, and then gently waking you back up again afterward. Pretty impressive, right? If you enjoyed this deep dive into anesthesia, please hit that like button, subscribe, and let me know in the comments what weird topic you'd like me to dissect next. Thanks for watching, and see you next time.